Can you guys hear me? Hello, TikTok. Did you guys see I just posted a video to you guys for the people that are due in May? Is anybody here due in May? Live chat. Facebook, YouTube. If anybody's here, let me know if you can hear me. It's kind of sketchy. Any questions yet? TikTok is just a filing in. I just finished a post on mistakes people make before going to the hospital. What does it mean when you have baby dreams? I have no idea. Krista says she's due in August, but it feels like a lifetime. I know that feeling, Krista. Yeah. Anybody else like, oh, especially it's getting to be summer. Is it hot where you are yet? Lindsay said 6 months pregnant and have bad sciatica nerve pain. Any recommendations? Stretching? Possibly an SI belt? Talk with your provider. Possibly chiropractic. Using a pillow between your legs when you sleep. Yeah. How to get relief from middle rib back pain due July 5th, but typically go between 36 and 37 weeks. I would guess that it's ligament pain. So if you tried like a maternity belt that kind of helps to hold up your belly. Yeah. Jasmine asked the difference between contractions and Braxton. So the main difference, hi Eli. I hope that's how you say your name. Sometimes I pronounce people's names that I see all the time on here, and I don't know if it's right. Anyway, difference between contractions and Braxton Hicks is that Braxton Hicks eventually don't lead to labor. They just peter out, and contractions or real labor, true labor, goes into labor, which is like the worst definition ever, but that really is the best definition. Krista said it's 80s and dreading it. It is close to 100 here. My daughter just biked home from high school and is not happy. She's going over to a friend's to swim. Mag asked, Zofran before 10 weeks. I'm desperate. Have you asked your provider about it? Are you just considering it? You haven't decided? Anyone here tried Zofran before 10 weeks? It's not unusual. Kimberly said, how do I increase supply again? Lost it once a month. Kimberly, I am not great at breastfeeding, so I sent everybody to the breastfeeding mama. Amy said, my PT told me to wear my maternity belt too often because it would weaken my muscles and my PT exercises aren't working. I mean, so are you postpartum, Amy? Because the muscles that we use to hold up our belly aren't ones that we need to like get better at. Drew, can you fix the door? Yeah, I already did. Oh, so I don't know. I don't know why yeah. I don't know why. I don't think those belly bands are bad. I would ask your provider what they think about that. That's kind of an interesting one. And I would ask your PT if that's something like, do they specialize in post or prenatal care? I just haven't heard that a whole lot. Some people say they decrease baby movement or something. So I don't know. Pregnant with third baby at 33 weeks, having Braxton Hicks so often, nervous he's going to be early. Yeah, have you talked with your provider? You might want to get put on like some nifedipine or something. Am I able to drink raspberry leaf tea every day? I'm 33 weeks. The studies show that raspberry leaf tea doesn't really do anything. Facebook, YouTube, if you guys have questions, ask them in the comments. But ask your provider. But I do have a post, Destiny, on the pregnancy nurse, which is my link in my profile. Just search on there raspberry leaf tea and or raspberry tea, and it will bring up the studies on it. It doesn't really show that it helps people go into labor. So some people say that raspberry tea, though, helps you less bleeding postpartum, and I didn't study that. I didn't look into those studies. Somebody's wondering if they have early pregnancy symptoms. Hard to know. I always recommend taking a test. What can you do to get baby to come? Nothing. It's like the worst advice, but there really isn't much you can do. 30 weeks pregnant, my baby slowed her movement. So I always recommend doing kick counts. On any of my websites, you can put in kick counts and it'll talk about how to do them. I have a kick count freebie that you can find under resources about my best tips for doing kick counts. But I recommend doing them so that you can kind of get a pattern of baby's movements. Baby's movements will change over time because baby just doesn't have as much room to like pull back and really give you a socket to you. But yeah, so have you heard of a woman still being pregnant even with a negative test? Yes. You're more likely to get a false negative than a false positive with pregnancy tests. Oh, somebody's wondering about baby dreams. If you guys have baby dreams, tell me in the comments. Let's see. Laura said, how can I start getting my cervix favorable? I was checked at 37 weeks, completely closed, ready to get this baby out. 38 weeks with number 3 and a boy mom. So yeah, I'm over it. Yes. Laura, no, there really isn't anything you can do. I mean, I've looked at all the studies. The main study is, the main thing is the medications that we give you to induce labor. Have you talked with your provider about an elective induction at 39 weeks? It's the best thing. I mean, I was 12 days overdue. I tried like all the things. They were not effective. I ended up getting induced. So people will say, oh, this worked, but the reality is they were just due. Like there's this rumor that eggplant parm will put people into labor, but how the restaurant got everyone to say that is they gave free eggplant parm to everyone who was due in the next week, right? If you were due in a week, come get some eggplant parm. It's going to put you into labor. And shockingly, within that week, a lot of people went into labor. So does that mean the eggplant parm put you into labor, or the fact that you're almost due put you into labor? And as far as the studies show, no, eggplant parm does not do anything. I have cholestasis and tracking labs weekly. How common is cholestasis in pregnancy? I'm not sure the exact numbers, Amy. It's not uncommon, but it's not like super common. But it's also not fun. If you guys don't know what cholestasis is, you end up getting itchy palms and itchy bottoms of your feet. Sometimes that extends more to the rest of your body. Amy, has they prescribed any medication for it though? Some people have had really good luck with the medicine. Some people don't. So yeah, and it can be a real problem. So you have to take it seriously. Let's see. My 2-month-old is having lots of tummy troubles. Leisha, I'm sorry. Talk with your provider. I don't know on that one. I know when I worked for pediatricians, they wanted to futz with formulas. So I don't know. Pelvic pressure, bruising like pain, 35 weeks labor near. I mean, you're 35 weeks. That's mostly what that shows. Doesn't really. Oh, Amy, you are taking the medicine for cholestasis. Yeah. Why am I 33 weeks and not showing? I don't know. Not at all. Are you measuring okay? Do you have any opinions on the maternal death rate and affecting Black and Hispanic women? What advice? I think it's horrible. That's my opinion. And I'm out here just trying to educate people as much as I can on talking with their provider, making sure people are going to prenatal appointments, making sure, you listen with your provider, but then make choices on your own. Advice is to really start asking questions like early on in your pregnancy. Get super engaged in your care and stay open to them. Stay open to their advice. I probably have remodeled too many houses, but I'm like, it's like a tile guy, right? Like the tile guy comes, and if you're getting like your floor redone, you're going to take the tile guy's advice. If you have like a dog and 3 kids and he's like, well, I wouldn't, or the flooring guy, we should say the flooring guy. He's like, I wouldn't do hardwoods because that's going to be scratched up, right? Like I'm taking the tile guy's advice because he's seen a lot of floors. Same thing with the doctor. So you're taking their advice and then ultimately you get to decide if you want to put in hardwood floors. And again, all of us would think you're an idiot if you didn't put in hardwood floors, but that's up to you. Same thing. It is the same thing. It's just a lot more schooling for a doctor. As a dental assistant and pregnant, what risks do they run? I mean, I don't know. Talk with your provider. I don't actually. I mean, obviously the risks of bodily fluids and stuff like that, being on your feet a lot. I'm not sure how much you're on your feet, stuff like that. I know as a nurse, like we always ran away when they did an x-ray, but there were other nurses that could cover for us. So I don't know what you guys do. Laura said she was over it earlier, last baby, so I really want that spontaneous labor, or at least try, so I can tell myself I did the best most I could. What is it though? If he's not here by 41 weeks, I'll get induced. I'm not down to have a 10-pound baby. Yeah. Um, sorry, Laura. I got nothing though. Studies show there really just isn't anything. But sometimes I really want you to look inside and wonder why you think it would be better if um if if something like sex would induce labor, why that's better than like the side effect, other than just being stuck in the hospital bed, which I totally get. Yeah. I'm 38, almost 37 weeks, 39 weeks, contractions 7 minutes apart, not severely painful, lots of pressure. Sounds exciting. Could be something, could also not be something. You just never know. Like it can totally peter out or it can totally get worse. And you never know until like you're going to the hospital, very sure that you're in labor. At least that's how I always found it for me. Is it normal with babies sideways to go ahead and bring patient Sunday night for induction? I'm not sure what you mean by sideways. If you mean babies like this way in the womb, like heads this way, or just like turned a little bit sideways. Shane says she's so done. That seems to be the theme of today's live for sure. I'm a first-time mom. Is natural birth better? I never know what you mean by natural. Some people mean natural meaning no pain medicine. Some mean not being induced. Some mean home birth. Some mean free birth where you have absolutely no one with you. So yeah. I'm 7 weeks pregnant and so nauseated and cannot shake how bad I feel all day. Talk with your provider. See if there's any medications that they can recommend. Once again, guys, I'm not great at super early pregnancy. I don't usually discuss that on here because I just don't know a whole lot about like spotting or progesterone levels or etc. Zia, no medicine. Have you asked your provider? That's what I would do. You could even call the office and just see what yeah. Can baby switch positions after being told baby's head was down at 22 weeks? Absolutely. Maureen, they can switch at any time. Kids are the worst. I asked for a C-section and my OB instantly disagreed with me, even me explaining my concerns. So they can decide if they're going to offer you a C-section, and then you can decide if you're going to have a C-section. Like that's just sort of how it works. They're really, really cracking down on providers offering elective primary C-sections. So, but if you're not too far along, maybe try again later. You never know. All right. Some messages were filtered. So I don't know if you guys know who I am. Hi, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience. I am also the creator of the online prenatal class for couples where thousands of couples have come and gotten prepared. I always call it the easy way to get prepared because it only takes 3 hours. You can do it from your couch. It's delivered on demand. And if you're looking for more information about like breastfeeding, nutrition, babies, baby sleep, the getting induced or how to go into labor, all of that is included with my bundle, the Bump to Bassinet bundle. So it has the main class plus the rest. So I would love it if you guys come and join me in there. If you guys ever have questions, feel free to ask them in the comments and I would love to answer them. I've had 2 membrane sweeps, lost my mucus plug a week and a half ago and still pregnant. Shane. Yeah, I feel you, Shane. Are you super overdue? Have you talked with your provider about elective induction? See what they say. Some hospitals don't allow it. Providers should allow it, though. At least in the United States, it is the ACOG recommendation that people should be offered a 39-week elective induction if they're interested in it and if the hospital has room. I'm 38 weeks, 5 days, and she wants to push me to give natural birth, but she estimates being 8 pounds at delivery or right now, I guess is the question. Yeah. I mean, there's no reason not to give it a try in my book. Can I do anything to dilate more, or do I have to just let it happen itself? There really isn't much we can do to help ourselves dilate. Beyond moving, like I love curb walking. I love just like rotating on a yoga ball. I love those kind of things, but there really isn't too much you can do to make your cervix dilate. 28 weeks, I fell straight on my stomach. Called doctor. They haven't called back. Should I go to the ER? I do think you should call labor and delivery and see if you should come to them or the ER. I think that's a good move, Dee Dee's. Shane, you're getting induced this week. Good luck, girl. You got this. I had a 9-pound, 6-ounce baby, 3 here, and also a fistula. Yeah, that is a good size baby, Sarah. Let's see, DNC on 4:30. I mean, there might ask them if there's a reason that they want to do that. Hard to say. McLovin, so happy I'm not pregnant. I got my period today. McLovin, I feel that way all the time, but I'm also very old. So if I got pregnant now, it would be a real bummer. And I just posted a TikTok or a reel or whatever about, what is it about? It's about moms who are due in May. So who is due in May? Tell us in the comments. Madison said I had my baby 5 weeks early and she was 8-11. Wow, Madison, that is a large baby for 35 weeks. Hopefully everything went well. I'm due May 13th. Guys, I'm a May baby. I'm a May 19th. Is anybody due on my birthday? And my daughter was due May 12th, I think. No. May 7th, or she was due April 17th, and I had her April 29th. So really winning over here. My daughter's pregnant. She is 16 weeks and still having bad vomiting. Talk with your provider to see if there's any meds they can recommend. I'm due. I get induced on the 14th. Exciting, exciting. So if you are due in May, a lot of you might be like, oh, it's too late to get in a birth class. But it really is not, you guys. That's why I created my class, because it's only 3 hours and everything is broken up into like 15-ish minute videos. Some are less than 15, some are a titch over. But people love it because you can just like shove it in before dinner, maybe one after dinner. Yeah. So come join me in the online prenatal class for couples. There is still time. You can find it through my link in my profile at The Pregnancy Nurse or Pulling Curls or at onlineprenatalclass.com. How do you know if you're leaking amniotic fluid? Kayla, I have so many answers to that over on my site Pulling Curls. It's a dumb name, but I have tons of posts about amniotic fluid. But the main thing is that amniotic fluid keeps coming out. So if you pee your pants, usually you just pee a little bit and then you're done. Or like you pee and then you're done. But if your water broke, usually it keeps coming out. Yeah. Madison said, yes, everything I did induce was in labor for 3 hours and had natural. Wow, that's a big baby. Do you guys have any more questions? Let's see. In the post I just edited was to make sure that you get your hospital bag packed. And I never packed my hospital bag. Tell us down in the comments if you packed your hospital bag. Yes, I am a registered nurse. I did not. Like, I had a few things thrown aside, like a contacts case, glasses, because I'm always worried. I wear contacts and I'm like blind without them. So I'm worried I wouldn't be able to see. Like maybe a comb. I don't even know. But I had a few things thrown to the side. And then I always went into labor super late. And I felt like it was bad juju. Like it was never going to happen if I didn't have my bag packed. I just packed the bare necessities. Yeah. Advice for anxiety during pregnancy from Ember. Ember, I 100% think taking a prenatal class will help because it just informs you a little bit more, but also like positive affirmations and just feeling like things are going to go okay. Telling yourself like, my birth team cares so much for me and things are going to go really well. Like just remaining positive instead of dwelling on the negative thoughts that your brain might put in your mind can really help. Keeping up with Shay, if I had my baby prematurely the first time, will that happen every time? Not usually, but sometimes. You never know. So keep an eye on it for sure. I don't know much about like trying after a DNC. What to do when baby is transverse for delivery? Are they thinking that you are up for a vaginal delivery, or they're thinking they need to do a version, or they're recommending a C-section? On the Pregnancy Nurse, which is my link in profile, you flip. And I have some of my best advice for getting baby to turn. Includes spinning babies, chiropractor, and aversion from your provider. Let's see. Sarah said, I have endometriosis. I can get pregnant, but I can't pass the 6-week mark. Sarah, I'm really sorry. That's a real bummer. I don't know too much about that, though, but I hope things work out for you. Nope. Positive in 8 months after chemical pregnancy, second month trying. Is this normal? The average time to get pregnant is 9 months. So that's all I have for you. When should I start drinking raspberry tea? I'm 32 weeks. We've had a couple people asking about raspberry tea today. The studies don't show that it is actually that helpful. So you can start drinking it, but it doesn't put you into labor, according to that. Dates, on the other hand, maybe. 6.5 months pregnant, don't feel baby kick or see him kick, but ultrasound always shows him kicking up a storm. Genesis, ask your provider if there's a reason. If you have an anterior placenta, a lot of times those moms don't feel the baby move as much because the placenta is kind of muffling the feelings of the baby. Stacy said, I'm 32 weeks with pregnant baby number 4, 9 years age gap between this one and the last. I have GD this pregnancy. Twice a week, 2 will be for an ST and all that. I'm so ready to have this baby. I bet when you're going to all those appointments, it's a lot. Baby weighed 4 pounds, 6 ounces, 30 weeks ago. I'm going to get induced just so I know what day I'll have him and my husband can be home for the birth as he works away. Yes, all of that sounds super normal. I have a video that's going crazy on Facebook right now about how when you get to be 9 months, an induction looks pretty darn good, even if the whole time you were like, I don't want an induction. There's a lot of great things about an induction, and I am grateful we have it. I never made the choice to have an elective induction, but with the new studies, I don't think it's crazy. 38 weeks, baby weighs 5 pounds, 10 ounces, stuck at 3 centimeters, 50% effaced. Yeah, 38 weeks, you're still a little bit early. So just hang out, feel the joy. I got a positive test, but I'm having sharp pains when I stand up. Any ideas? It can already be a ligament pain where your uterus is growing and those ligaments are just adjusting. So talk with your provider if you have any questions, though. All right. Anything else for me, you guys? Just had a friend message me. I do not know anything about HCG levels. Yeah. So best of luck to you. Any other questions? So glad that you guys came and joined me here today, though. Once again, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I'm just here to help you guys out with all your pregnancy needs. So thanks for joining me. Somebody just asked, I'm anemic. Can it affect me when I give birth? Having a low blood level can affect you, but hopefully you're taking iron and that's helping out. There is always a chance that you'll need like a transfusion or something. So talk with your provider about what it's looking like. Do you know anything about PCOS? Not that much. Sorry. All right. Everybody have a great day. I'm glad you guys came, and best of luck to you.